1480 AM, their staff, or management, but are strictly those of the hosts, guests, and callers.
Source of information, the only place where you could reach, where you could actually get information regarding Medicare, Social Security benefits, low-income subsidy, and a whole lot of other information. It is indeed a pleasure for me to be here with you today to talk about certain information, some that's coming out in the near future. We're about to embrace what we call open enrollment. We're going to talk more about open enrollment in a little while, but what I want to talk about right now with you, I want to talk about, I think I lost my camera here. I'm going to talk about a little bit more about something that probably is going to happen on this Friday. This Friday, CMS is going to announce whether they're going to give everyone that's on Medicare or low-income subsidy. I'm sorry, not low-income subsidy. Everyone that's receiving retirement benefits, SSI, disability, or veterans benefit. They will announce whether they're going to give you an increase on the amount that you're receiving. I see that I have a call. Okay, so on the amount that you're receiving on a monthly basis. So let's talk about that. My personal analysis about that is first of all, let's explain it for those of you that this is the first time navigating through this system. Let's really give you an idea what this is all about. Because of the level, what they have done to maintain your spending power intact, what they've done on a yearly basis, they base it on the inflation rate, whether to give you an increase or not. Because if you take an example about a year ago, they gave an increase of 4.7%, and by mid-year, they had literally, the inflation have gone so high that the increase that they had given you had completely evaporated. So a lot of people was having a lot of difficulties making ends meet towards the end of the year. Last year, by this time, at one point, the inflation had gone up to 11%, and it went back down. So by the time, this time last year, they decided to give everyone an increase of 8.7%. So that was the necessary increase. That was the increase that they give for this year. Now, 8.7%, and so far this year, the Federal Reserve have taken certain measures by increasing interest rate in order for them to bring the inflation down. The target that Federal Reserve was trying to get, or still trying to get to, is 2%. So right now, the last data that came out, it was at 3.7%. And I think at the very least, if they decide to give a raise to everyone, it'd probably be around 1%, 1.7%. My concern with that is for you to get a raise for 1.7%, and on the other end, they're going to increase the premium for Part B, then it kind of wash out the raise that you're getting. For a lot of people, and I'm talking about those that are not eligible to receive Medicaid, or with Medicaid or what they call qualified Medicare benefits, allow the state to pay the premium for the Part B. So those of you who are not eligible to receive Medicaid, then you will not see that raise. Actually, the increase that you will see would be very minimal. But in the same token, there's a raise associated with your premium Part B. Um, so when you balance it out, you're probably getting what, maybe $2 increase. And in the past, I've had some people that called me back and said, Gilbert, they talked about a raise. I didn't see it. I said, well, what were you getting before? And what are you getting now? I said, well, this is what it is. For a lot of people, amount to maybe $10 or less. So coming this Friday, it's what you call a cost of living adjustment. In short, they call it COLA. So the increase that they give you is to make an adjustment in the cost of living so that you could be at the level where whatever you were spending or the value of your dollar last year, what the amount of product you were able to purchase last year, with the increase, you still will be continuing to purchase the same amount of product, but at a higher rate. But you would not feel the higher rate because you receive an increase. As I say, my analysis, I don't think that they will give you a raise, because the inflation, although it was at 3.3, went up to 3.7. The raise will not forthcome in this year, which is it's not too bad, because remember last year, if I recall the number correctly, the premium for Part B was 180 something, or 170 something. The difference was about $5 from what it was last year to what it is today, 164.90. So when we're talking about $5.10, so it was basically close to 170. What we had predicted at that time was that the premium Part B will exceed over $200. I anticipate about $220, because when you take what they did in the previous couple of years, how the increase came from one amount to another amount. So we had anticipated for them to continue increase premium Part B, and at that point it would have been very, not for some people, because the vast majority of people that, especially those that follow us in the clinic at CAMAX Medical Centers of Broward, what we do is we file for Medicaid for them. So the Medicaid that they're receiving, the QMB, it covers the Part B premium. So actually, they are getting the state to pay the premium Part B for them. But those of you who do not have that, or who's not in a center that provide you with that type of service, that's a different point of view. So we're talking about a premium Part B. Sorry, I lose my train of thought. So the COLA, with the cost of living adjustment, that's not something we're expecting this coming year. And usually when they give you a cost of living adjustment, they also increase the premium. So what we were talking about, anticipate that the premium Part B would increase to over $200. Well, what the Biden administration did, which was absolutely great tactic, is instead of increase it, reduce it by $5. So everybody was able to see an increase, a large increase at that, which it was at 8.7%. So because of that, I don't anticipate that you will be getting an increase this coming year, and I anticipate the premium Part B to remain the same. But this Friday we will know whether I'm right or wrong. So far, last year I was partly right. I know that you were going to get. I had anticipated that everyone would receive an increase about 10%, because remember, by October, the beginning of October, oh no, let's say the late August, the the inflation rate was at 11%. I'm going, well, that's a foregone conclusion because now everybody's going to get at least 10%. And but fortunately for a lot of us, the the Federal Reserve applies certain increase on interest rate. So now, which was able to bring it down to by the time they came on air to announce the increase, it was they reduced it to 8.7%. 954-667-4885. 954-667-4885. Let me hear from you. Oh, by the way, this month is breast cancer awareness. For those of you who, I promised to announce this on air. For those of you guys who's living in North Miami Beach, and if you listen to anywhere in the other state, which I will be sending this to a lot of my friends up north, there are certain areas where they are giving free mammogram screening. So I really, in your area, find out where they're giving free mammogram breast screening. I would suggest Google it. Do whatever you have to do, especially my friends in New York, in Jersey, my friends in Boston, and the other states. I have friends in different states in South Carolina. So Google in your area where they are giving a free mammogram screening. Make sure you get that done. It's very important. That we are dedicating this entire month to that cause, and whatever we could do to help, we're very happy to do it. They are in North Miami, I believe. I will pull up that information for you guys. They are giving free breast mammogram screening, and I believe it's. I'm going to try to find out the information when I come back in the second half. We could talk more about it, and I'll make sure I get after the break. I'll get the information for you and pass it on. I believe in Dr. Roman Joseph. He's got a program called Aware. So if you call his office, and I'll get that information for you as well, where you guys could call and get a prescription to get a mammogram screening. 954-667-4885, 954-667-4885. So let's go back to continue providing the information for you. If you are calling me right now, call me. Oh, by the way, I am in the studio live, so you could call me at 305-945-1580, 305-945-1580. I don't know if I did give you the right number before, but anybody that needs to call me, make a comment about anything that I just said thus far, please call right now, 305-945-1580, 305-945-1580. Hello, you on the air.
Alors, bonsoir.
Bonsoir.
C'est ça, Mr. Gilbert. Bon, comme il y a des questions qui leur posent, il y a l'autre monde tout. Moi, je sais, encore l'autre jour, moi-même, moi, j'ai Yomana. Et puis, il y a review medication, ça m'a habitué, quoi. Il a fait, il y a moi, après, il dit pour qui ça, qui fait vraiment des informations, ça, m'a dit comment payer bill, moi, pour qui comme m'a touché. Il dit c'est petit, moi, il est parfois qui aide, moi. Après, il dit ça fait. Il y a posé une question parce que il y a besoin de connaître combien il y a bon comme il y a des gens qui ont un genre de problème. Mais après, il faut faire attention. il y a un monde qui a pris le mandat d'information ça puis elle prend l'argent sous nom plus que moi c'est même mon yomana c'est habitué et faire review ça on va connaître si l'on problème.
Hold up, tell me what you want. I'll traduire ça, Dion. The listener is asking. Apparently, he's in a Humana Health Plan, and they call him to offer help. Whether he needs help for certain things, certain question he was asked, like who helped him with paying his bill. He told him that his sibling are the one that's helping him. So he want to make sure that this is a legitimate um, group of people that's calling, because there's a lot of people out there right now that's calling with the intent to defraud you. So I'm going to respond to him in Creole, and then I'll tell you guys exactly how I respond to them. OK. Merci pour patience. Faut faire un peu attention avec moun caprelo, parce que moun qui plus facile pour yo prendre avantage de yo, c'est moun tankou, c'est moun senior cap struggle pour yo vivre. So pour raison ça, faut faire un peu attention. Moi-même qui ou même prends numéro de téléphone yo, prends nom moun nan, et puis dis est-ce que premièrement demandez est-ce que c'est son social worker qui travaille en dedans Humana. Est-ce que qui est sûr? Faut poser question avant qu'on commence à bailler information. Parce que à la minute que vous baillez information, surtout social sécurité, date de naissance, vous déjà un téléphone, bien sûr, vous avez déjà une adresse surtout. Humana pas venir avec un quand il s'agit de compagnie assurance, OK, songez que compagnie assurance yo même yo ont 3% de profit pour yo faire. So yo pas venir avec des programmes côté que yo pral bon cob, parce que cob yo pral bon là pral sortir dans profit que yo a faire. Ouais quoi de mi voilà?
Oui, pas photo.
So là, il faut faire un peu attention avec un petit de information pour le faire. Si c'est assurance humaine que vous gagnez, relais d'abord, vous gagnez dit mon pour rendez-vous relais dans 2 mois si Dieu veut, relais humaine demander que est-ce que vous avez un type de service ça que ba. Relais agent. Qu'est-ce qui est agent? Relais agent et puis agent qu'on a la clarifier ça pour. M'gon monde que nous déclarer les kounya qui t'a clarifié ça pour moi. Pendant dans l'air là, par contre, c'est que nous avons bien temps pour nous faire ça. Dès que bon regarder, dès que les gens et puis lui-même il était plus ou moins bon une idée est-ce que Humana a ça parce que lui-même c'est pour Humana que le travail. Bon, il pas travaille spécialement pour Humana, il était qu'on travaille pour Humana jusqu'à présent ils sont agents pour Humana tout. So, si que le carré répond moi, moi-même, je regarde dans quelle façon que je peux mettre dans l'air. Et puis depuis le répond moi, et puis je pose quelque chose ça. OK. Bon, petit peu, on va mettre là. What I've done is explain to the listener that he has to be very careful of who is providing his information is, because there's a lot of people there that's defrauding them. However, all the insurance company, they have a minimum amount, a minimum amount of profit that they have to make. So those it's basically 3%. So you have to be very careful who you provide your information, how you providing the information, and so that they're not taking advantage of you. Elderlies are the most easiest people to take advantage of because they're vulnerable and they are in need. Because of that, so you do not provide your social security number to them. You do not provide your date of birth to these individuals. Hello, hello, Renard?
Yeah, yeah.
Okay. So you do not provide your certain information to them so they don't take advantage of you. I hope I have Renan on the other line. So okay, I was back à joindre Renan Kounia.
Okay.
So but pas ba information relé agent, relé Humana, assurer que ça y est là c'est ça lié. Mais faire un pile attention parce que et surtout époque ça, c'est époque pour que après l'eau, grand pile compagnie après l'eau, grand pile monde après l'eau et puis si que kounya ou fond ba qui passe ça, kounya li ka prend il ka coûter you ka prendre information pour yo ça veut dire identity theft, get medical theft too, tout bas ça. So au juste faire un peu d'attention. OK, d'accord.
Merci un peu.
Merci pour l'appel. OK. Bye bye. So what I've told him is that he's going to call Humana trying to make sure. Because see, around this time of the year, and that's the next subject we were going to attack, which is around open enrollment, which is actually open enrollment starting October 15th to December 7th. And I'm going to get into what's open enrollment with you guys. What I was trying to do is trying to get an agent on the line, and she could clarify for us this information that we're getting. What I find in the past is that there are some people out there that's working overtime just to take advantage of the seniors. The seniors are a very vulnerable group of people. And that's why you see when you have an agent that comes to your house or even pitching you a plan, anything that they are talking to you about, it has to be pre-approved by CMS. CMS is Center of Medicare Medicaid Services. So it has to be approved by CMS. And if they leave a booklet with you, the booklet, underneath the booklet, there's certain inscription that's underneath it. So that's what has to be on all the booklet that shows that, yes, it was presented, that plan was presented to CMS, and CMS approved it. So when they sit down and doing their presentation, they have to go explain to you exactly, word by word, what's in the booklet and what are your benefits. 305-945-1580, 305-945-1580. We're going to continue. Continue to call. We'll do the same. We'll try to navigate between the Creole and the English and answer your question. But don't hesitate. Call now. 305-945-1580, 305-945-1580. Oh, before I go on, the 3 o'clock show, normally we have Dr. Semelis on, but we have a special guest that's going to come on. So I highly recommend that you stay tuned. We're going to discuss breast cancer. So I highly recommend. Unfortunately, it's going to be in Creole. So for my English friends, if you have anybody, actually, let's do this. This is what I would like to do for my English friends. And I have some friends and some that I'm aware of that's a breast cancer survivor, and some I'm not aware of. And this show, we're here to support you. So if you would like to come on air and do an interview with me, and it's going to be done in a very tasteful way. I don't know if you've heard some of my interviews that I've done. I have not had the opportunity to bring anybody to do an interview with them on this hour from the 2 o'clock to 3 o'clock hour. But listen, if you would like to share your experience, and I'm talking about you, that's anyone that's a breast cancer survivor, your experience, what you went through, and I guarantee it will save a lot of lives just by allowing anyone to just get an idea, a snippet of what you went through, so that I believe that that's going to prevent further more people from getting breast cancer by doing their regular mammogram screening as it's suggested by the medical community. They talk about from 40 to 60. We won't get into the medical aspect of it because I like to have a doctor here with me when we do that. But yeah, if you would like to come on, call me on 954-667-4885, and we'll do that. And you know, when you call me and we'll discuss it, it would be just like having a conversation. But it's important for your sisters. We're all brothers and sisters. That's coming up. So if they see, understand, and could appreciate what you went through, that will prevent them from going through the same thing. Okay? Having said that, yes, let's get back to open enrollment. So open enrollment is the only time from October 15th to December 7th is the only time that you could actually change plan. For some people, okay? A lot of agents look towards this period of time, that short window, to say that I'm going to make a lot of money this year. And you know, when I was an agent, and I always was dumbfounded by that reaction, because then you got a mass people that's getting into that type of work, and just for the sake of making some quick bucks, and then after that you don't hear anything from them. So I always tell other agents, and even after I left doing that type of work, I was more geared toward the medical field as a whole. And I used to encourage my agents. I said, listen, yes, it's open enrollment, but you know, open enrollment is throughout the year. So throughout the year, from January to December, you're here to find wherever those patients are, enroll them in a plan, enroll them in a medical center, and so that they could get the best of care they can. So, but for some, for example, in my office, we apply for Medicaid, we apply for food stamp, we all apply low-income subsidy, everything that we could put together with your Medicare and your Medicare Advantage plan, so that you could have one of the best benefits available today. Having said that, so throughout the year, we continue to enroll patients in our center. However, you have some that makes, it's based on income, that makes more than, right now the amount is $1,654, that are not eligible to receive Medicaid. And let's say, for example, you're making even more than that, you're in the 2,000 range in terms of Medicare, in terms of retirement benefits, you are definitely not eligible to receive Medicaid. So you're the type of person that you cannot change your plan throughout the year. You have to wait until that window is, if you need to change your office, if you need to change a doctor, if you need to change the plan. So this time of the year, that's for those people. And we highly suggest that if you're somewhere, you're in a center, you're with a doctor, you're with a plan, that you're not satisfied with it, before you make any move. Now, there's a booklet that every year Medicare sent out. It says Medicare and You 2024. So inside that booklet, they have all the plan within your area, all the Medicare Advantage plan, and they break it down by plan, each plan, and explain to you each benefits. Break it down by benefits also. So I highly, before you make that move, go and do that research. If you decide that you have a particular doctor, if you're going to change your doctor, and you have a particular doctor in mind that was referred to you, then the best move is, first of all, find out in your area which Medicare Advantage plan has a 5-star rating. Just like when you go on vacation, you took your time to pick which hotel that's platinum, which that's something my wife sit down and do, and she go and find out which is the best hotel, and to make sure that during the time on our vacation we have an awesome time. So I invite you to do the same with your plan. Find out which one has 5-star rating. You're not going to find too many Medicare Advantage plan with 5-star rating because it's a high hurdle to get to. Down here in South Florida, we have one particular company in the past 6 years have consistently been getting a 5-star rating. What that means is that the clinic that associated with that plan also has a 5-star rating. Max Medical Centers, for example. So the 5-star rating is very important. You based on your choosing, you figure out, okay, and since this broadcast is streaming live right now on YouTube and on Facebook, so we invite you to share it. So go on, talk to your doctor, find out which Medicare Advantage plan that they take, and then compare it. Then the second place, compare it with which one has a 5-star rating. If you don't have one that have a 5-star rating, and you may have to go to 4.5 stars, then by no means you do that. But make sure that the plan, study the plan. There's different plan for low-income individual. There's different plan for the example I just give, someone that's making over $2,000 from somebody that receiving $2,000 from Social Security, retirement, or disability. 305-945-1580, 305-945-1580. So, having said that, you need to do the research and make sure you pick the right plan. The plan that's coming out in 2024, I could tell you what I've heard thus far for the plan that's coming out in South Florida. They've increased the over-the-counter medications. One of them has increased it to $175. They've also increased the meal card, the healthy meal card. So which last year was Humana that was had the highest, and they allow you to combine the meal card with the OTC. I believe a lot of companies are doing the exact same thing this year in South Florida. I don't know about any other places. So in your area, I suggest you call your plan and find out. I don't know if you have OTC in New York, for example, because in different states the Medicare Advantage plan varies a bit. Okay, no, you don't have to pay a dime for the Medicare Advantage plan. That's the greatest part about it. And the other greatest part about it is that if you just using your Medicare, okay, you don't have a Medicare Advantage plan associated with it, well, Medicare covers 80% of the bill for you. The 20%, you'll get a bill for it. That's why it's important to get a Medicare Advantage plan, to put it with your Medicare. The Medicare Advantage plan would be primarily, your Medicare would be the secondary. And right now we're going to concentrate on those individuals that's not going to be eligible for Medicaid. And let me tell you, my belief is that the group of people that's coming that's receiving benefits now, it's highly likely that you're going to be eligible for Medicaid because you're talking about individual that started to work when they were 15, 16, legally 16. That's when I started at 15, and legally they were taking tax from me starting when I was 16. I've been paying tax a long time. So those people now, because they base it on the last 35 years of your work history, because of that now, when if you've been working that long, the amount that you're going to be receiving from Social Security is well in the 2,000, 3,000 range. And if you decide to take those benefits at age 70, yes, you're going to be in 3,000 range. And no, you could forget about Medicaid because Medicaid is not for you. So the majority of my friends that's coming into retirement or will be retiring at the age of 67, well, you're not going to receive Medicaid. So we got to change that focus and start talking to you guys. Because a very small minority of you guys will be eligible for Medicaid. Now, every time they increase the cost of living, they make a cost of living adjustment, they've also increased the level of income that you need to be receiving to be eligible for Medicaid. So there's some I get light at the end of the tunnel when it comes down to the income that you're receiving. But in the same token, remember, it's the state that's paying for that part of Medicaid. So the state is going to reach a point they're going into, they may boycott it because then that's taken out of their funds. Of course, the federal government may have to come in and added some fund or increase their funding for that particular plan because we know that the seniors definitely they have to be taken care of. I'm saying the word seniors. It's unfortunately with those gray hairs and a lot of my friends, we soon will be the seniors, healthy seniors. I hope. 305-945-1580, 305-945-1580. Let's have that talk. So a lot of you guys will not be getting Medicaid. And so we got to talk about the plan. What's the difference between you getting Medicaid and Medicaid? The main difference is that someone who's eligible for Medicaid is on a plan where that plan is basically, I would say that plan is as good as the plan that the President of the United States is receiving, if not better. The only difference is that the President of the United States, their plan, they probably go to any state and see a doctor. With the Medicare Advantage plan, you have to be within your living area. So if, for example, if you live in Fort Lauderdale, which is Broward County, your plan your providers have to be within Broward County. You cannot go outside the county. So that's the only difference. But the special need plan, as they call it, you get everything is zero, whether your visit to the doctor, your specialist, in some cases even a hospital. There's you get covered for dental, optometry, and you see a various different type of specialists. So you are covered from head to toe and at a zero plan. However, those that do not have Medicaid and certain Medicare Advantage plan, if you're eligible for low income subsidy is basically, actually, let me give you a history of it. Under President Bush, the son, it's one of the greatest things he did was, although it was unpopular with his party, he managed to pass the low income subsidy bill. And what it does is the federal government pay a portion of the prescription drug for you. And I remember at the time I was selling Medicare Advantage plan, and for me at the time it was the best thing that happened because you came from a lot of people not eligible for certain benefits, and now you're able to, because of the low income subsidy, you're able to apply for low income subsidies for them, and at the same time be able to enroll them in a plan that's they're going to save money, and it was zero out of pocket for them. Um, and we are able to apply for you. When you receive, there's an envelope that you receive when you apply for Medicare, a 5x7 envelope. It basically it says extra help with prescription drug. That's the low income subsidy application. So if you received it, you fill it out with the necessary information and send it back. Okay, very important. Um, so it covers all the plans covers for your Part D, your prescription drugs. Again, depending on where your plans falls, and we left off with having low income subsidy. For a lot of you who have low income subsidy now, certain plans allow you to go on a special need plan. So they put you under the special need plan, and everything for you becomes zero, just like someone who has Medicaid. Now, my personal wish is that all the Medicare Advantage plan could be unified, and no, that's a little far stretch. If we could have similar plan, whether we have, I'll name a company. We have a Health Sun. We have a similar Humana in every state that's providing you with the similar benefits they're providing down South Florida. Granted, South Florida has a high community of seniors, so their reimbursement is the most important thing. Their reimbursement is much higher here. Actually, if you compare, and I think it's still the same way, if you compare South Florida, Dade County reimbursement as opposed to Broward County reimbursement, at one point, Dade County reimbursement was much higher than Broward County. As you go further up north, it decreases. So, one thing that if we could, and this is something for the lawmakers, and I don't think it's doable until somebody realizes that, wait a minute, we made the certain adjustment that we need to make and make it unified throughout the states so everyone could receive an adequate benefits, and not concentrate on trying to find a way to reduce it, but find ways to continue to improve it. South Florida, that's one thing that I have to say about it, is that from year to year, the benefits have increased and have proven to be much better. So in this year is the same in terms of they've even for the past couple of years they've added acupuncture. We had a gentleman on air a few months ago, and he was talking about acupuncture, the importance of it. So they added acupuncture. You have dental. You have optometrists. and they give you a certain amount for you to get your glasses. Now, if you go above that, then you're gonna have to add the additional amount. But listen, by far, it's a great plan. And best part about it doesn't cost you anything. I'm a very high advocate for Medicare Advantage plan. I don't particularly promote one in particular because they're not paying me to do that. But the logic behind it of providing these type of benefits. Listen, at one point, I had people coming to me and ask me how do they get diapers for their loved one. Now in the OTC, they've included product for incontinence, and but for both male and female. So that by itself, that's a big move. 305-945-1580, 305-945-1580. Apparently, I don't have too many English listeners, but I hope that you stick around. Those of you who speak Creole, for the next. I'm excited about it, but like I said, we're gonna bring before the month is over. We will find someone that's willing to do this show for me in English regarding breast cancer, even a doctor. So we're gonna find out. We'll see what we could bring for you guys, so you're not left out. Granted, we just recently started with the English version of this show. It takes a lot of work to pass it on, so we are asking for your help. You who are listening to, I had some friend Gilda, and her sister, and you guys are in Pennsylvania, I believe. Big shout out to you guys. Share the information. This show, by far, it's the only show in South Florida that you're going to see that's going to provide this type of information that I'm providing to you. Not only in South Florida, I think I venture to say that if we, it's very difficult to find any show that's unaired that's providing information regarding Medicare or retirement benefits. So share the information. Go on YouTube. It's WSRF 1580 AM on YouTube, and press the subscribe button. Subscribe to this show, and every show of source of information. Every time we're on the air, they will send you the show live, and you could listen to it at your own time. You could share it with a friend. As I'm talking, there's a few people that's coming to my mind. Kit Lee in Boston. So thank you. We know you're listening. Maud, we know you're listening. So there's a lot of friends that are listening. We be sending big shout out to you guys throughout the United States. And let's not remember we have some friends in Canada. Josiane, we know you're listening. Mr. Dorval in Canada, we know you're listening. So all of our friends that are listening, we send a big shout out to you. And please share it with a friend. Share it with a family member, especially those of you that are in the United States, because this information is power, especially when you reach at the age. I was talking with someone earlier, and she said to me that she doesn't know what she's going to do when she reached the age of 65. And I asked her, why? She said, well, I have so many options. Can you imagine that? She has so many options of whether it's the centers, whether it's doctors. Of course, my response to her was, I only have one option, which is by far the best. Call me, 954-667-4885. You are up north and considering moving down to South Florida. Christine, I'll send this show to you, to Christine. Call me, and I'll tell you what's the best thing to do. And I know a lot of my friends that's considering retiring down here. Come on down. The benefits down here in terms of um, retirement, well, the retirement benefit, I think the money itself is much bigger than what you would receive if you work down here. But nevertheless, when you come down to the health part of it, the medical part of it, the plans down here are far much better than anywhere else in the United States. So we were telling you a few minutes ago, it's comparable to the president of the United States. I do believe that. And even those of you who's not under Medicaid, the plan that you receive is still comparatively much better than what you receive anywhere else. And if anyone that's listening to me right now, you could challenge me on that. You wanted to challenge me on that. If you're an agent actually, in the other states, and you have the information that we could cross reference, I'll invite you on air, and I'll get an agent that's knowledgeable about the plans down here, and we'll compare it. And it's good because what we're doing is bringing light to the plan that you have within in your state, and inform others about it, and and able to make a educated choice about the plan, about the choices that they're going to make. 305-945-1580, 305-945-1580. I see we have only 3 minutes left, probably less. So we invite you to call now with your question. I think the listener that called earlier regarding the call that he received from that particular company about offering them benefits. There's you're going to be receiving a lot of calls coming up in a few months, so be very careful not to share your information with someone you don't know, or someone that's just calling you over the phone. Make sure that you guard your information so that you don't become a victim. It's very important that you do that, because right now it's around that time where they will make sure that they take advantage of you. Again, it's a pleasure for me to be here. I got to get ready. I'm surprised that no one has come in yet, so I still have time. It's a pleasure for me to come on air and share those information with you. I want to encourage you throughout the week. If you have any question for me, you could reach me at 954-667-4885, 954-667-4885. During the week, it will be my pleasure for me to answer you. Once again, my name is Gilbert Franklin. You could reach me at 954-667-4885, 954-667-4885. I hope you guys have a pleasant week, and the rest of a pleasant weekend. All right, bye-bye.